Thank you very much. Thank you all for being here. Welcome. Good afternoon. It's delightful to see you, and I want to thank everybody here who has come to take part in this conversation with us today. When I first conceptualized the Dean's Changing the Conversation lecture series, I knew that I wanted to host leading thought experts and scholars who would inspire us to think in new ways about pressing issues central to the mission of public health, to seek new opportunities to move our community forward and our nation forward despite pervasive challenges. I can't imagine a more important time in our recent history to be having these conversations, the kind that inspire us to shift our perspectives, open our mind to new concepts, reframe our thinking, and inspire us to action. At both the national and the state levels, there's increasing pressure to change the landscape of what is and is not allowed, from how we teach about systemic racism and LGBTQ plus issues, to whether we can receive comprehensive medical care, including sex-affirming care and abortion. I'm delighted to welcome today's guest and along with you to learn from her. Michelle Goldberg became an op-ed columnist for the New York Times in 2017 and was part of the team that won a Pulitzer Prize in 2018 for public service for reporting on workplace sexual harassment issues. She's the author of 3 books: Kingdom Coming, The Rise of Christian Nationalism, The Means of Reproduction, Sex, Power, and the Future of the World, The Goddess Pose, The Audacious Life of Indra Devi, the woman who helped bring yoga to the West. Her first book was a finalist for the Helen Bernstein Award for Excellence in Journalism. And her second won the Ernesta Drinker Ballard Book Prize and the J. Anthony Lucas Work in Progress Award. Previously, she was a columnist at Slate, a frequent commentator on radio and television. Ms. Goldberg's work has appeared in The New Yorker, Newsweek, The Nation, The New Republic, The Guardian, and many other publications. She's reported from countries including Iraq, India, Egypt, Uganda, Nicaragua, and Argentina. She lives in Brooklyn with her husband and children. Michelle, welcome and thank you so much.
Thank you so much. Hi. Thank you so much for having me. This is actually the first talk I'm giving since the pandemic, so I'm very excited to be seeing all of you in person. So your semester here, I think, is over pretty soon, right? You're done in May, is that right? I think in all likelihood, when you return to campus you return in September, you return in October, in August. When you return in August, it is very, very likely that Roe versus Wade will have been overturned and that abortion, or almost all abortions, will be illegal here in the state of Ohio. At about this time last year, I think there was some doubt, at least among a lot of the legal experts I talked to, whether the conservative Supreme Court was going to just kind of gut Roe versus Wade or overturn it outright. There were a lot of people who believed that in order to preserve the perceived legitimacy of the court, that Chief Justice John Roberts, a conservative himself, had an interest in maybe, kind of keeping the precedent of Roe versus Wade, but just radically curtailing it so that far more restrictions would be allowed, far more clinics would be closed down, but there wouldn't be this sort of abrupt, dramatic shift in, you wouldn't have headlines that say Roe versus Wade overturned. Most of the people that I talk to, the legal scholars that I talk to, have changed their thinking about that in the wake of the Supreme Court's refusal to strike down the SB 8, the Texas abortion bounty law. And I'm not sure how familiar you are with the details of that law, but Texas passed a law that bans abortion after 6 weeks, no exception for rape or incest. And it has this novel enforcement mechanism, this kind of bounty enforcement mechanism, because when the Supreme Court strikes down a law, it usually enjoins public officials from enforcing that law. Texas's innovation was to say that public officials won't enforce that law. Your neighbors will, like randos will, anybody who wants to will. Essentially, you as a person in Texas can sue anyone who either performs an abortion or abets an abortion. The person who gets the abortion themselves is exempt, but anyone else, the Uber driver who takes them to the clinic, the fund who helps them pay for it, the mother, if she drives her daughter to her appointment, any of those people can be sued if there's an abortion. And the person who brings the lawsuit, in addition to getting damages, can have their court costs reimbursed. So there's a big incentive to do this. And now it was obvious that this law was an attempt to kind of get around Supreme Court jurisprudence just on a technicality. And because of that, most people I know, people who are very cynical about the Supreme Court, who are very cynical about the future of reproductive rights under the Supreme Court, did not expect this particular law to stand, because it's an insult to the court's own prerogatives. Right? It's just such a blatant attempt to subvert the court's own precedent. And I remember when I was writing a piece, because what happened was the law just kind of went into effect and the Supreme Court didn't do anything, and people were waiting. They were waiting for the order to come down. And when it just said, it was this kind of astonishing thing that it was just going to go into effect like by default. And so I hurried up and wrote this piece, but we got it up really quickly because we expected that within a few days it would be struck down. And then it wasn't. And then finally, the Supreme Court, refused to even hear that case, and it's allowed this law to go into effect. And not only now do we essentially have a state in the union where Roe versus Wade, for all intents and purposes, doesn't exist, but the sort of blatancy of this, the kind of clear departure from precedent, I think, has given us a signal about, this court doesn't really mind being seen. Well, they don't like it when people say that they are extremely partisan and kind of extremely results oriented, but they're certainly not going to change their rulings in order to avoid being seen that way. Chief Justice John Roberts wrote, because he himself didn't want to let this law go into effect, the clear purpose and actual effect of SB 8 has been to nullify this court's ruling, but he's now a minority. There's a much more conservative majority on the court. So there is a case out of Mississippi, the Dobbs case, which bans abortion at 15 weeks and asks the court basically to overturn Roe versus Wade. And I think the assumption of most people, although it's not guaranteed, is that that's what the court will do. And so once that happens, in some states, abortion will be illegal immediately. 22 states have either what are called trigger bans. Trigger bans are laws that are passed to basically say, as soon as Roe versus Wade is overturned, abortion is illegal in this state. Other states just have laws still on their books from when abortion was illegal that could presumably go back into effect. Here in Ohio, you have a trigger ban in the legislature. And so I think the assumption is that it has a good chance of passing. So abortion is very quickly going to become illegal, and or at least illegal in many states in this country. And the thing that I most want to try to get across is that, sometimes people say like, we won't go back, but we're not. This isn't a matter of going back. Post-Roe America is not going to be like pre-Roe America. In many ways, it's going to be worse. And here's why it's going to be worse. Doctors were prosecuted for performing abortions under Roe versus Wade. Women actually rarely were. They would be threatened often with prosecution in order to get them to testify against doctors. But women in general, you didn't have a lot of women being jailed for abortion. And the crime was abortion. The crime wasn't murder. What we've had since Roe versus Wade and since the birth of the modern anti-abortion movement has been a many decade effort to recodify abortion as murder and also to confer legal personhood on embryos and fetuses. And we already can sort of see what that looks like even while Roe versus Wade stands. A number of states have passed what are called fetal personhood laws. And these laws on the surface make a lot of sense, right? They often happen in the wake of an assault on a pregnant woman that results in her losing her pregnancy. And so these laws are often presented as a way to protect pregnant women. They make it so that, so that you can bring homicide charges in the death of a fetus. The mother is exempt because of Roe versus Wade, but other people are not. Although in practice, the mother isn't always exempt. It depends on the state. So what happens is that these states have passed these laws, and these laws have very quickly been turned against women themselves. So some of you have probably heard, for example, of Bebe Shui. She was a woman who very late in her pregnancy tried to commit suicide, and it resulted in a stillbirth, and she actually went to prison before her conviction was overturned. There was a woman named Purvi Patel in Indiana who ordered abortion pills from, I believe, a pharmacy in Hong Kong. She then had a stillbirth and was convicted simultaneously of it was either manslaughter or homicide and child endangerment. And so there's been hundreds, not quite that severe, but there's been hundreds of cases all across the country of women prosecuted for child neglect, fetal endangerment, fetal homicide, often for decisions that they make while they're pregnant. I mean, sometimes, kind of desperate attempts to end their pregnancy. There was another woman who was arrested because in a fit of desperation, she hurled herself down the stairs. In other cases, women have been arrested for filling a pain prescription from their doctor, for taking half of a Valium in one case. It becomes a license to prosecute women for all kinds of decisions that they make during pregnancy, as well as all kinds of ambiguous pregnancy outcomes, because as I'm sure you know, miscarriages are very, very common and often are, kind of hard to attribute to any one cause. Something you see in countries where abortion is illegal is often women being prosecuted for miscarriages because, they come into the hospital, they're bleeding, they can't prove that they didn't take a pill to induce their miscarriage. And so sort of cloud of suspicion falls on them. Anybody who has a miscarriage, their body is liable to be seen as a crime scene, essentially. So it is very, very likely that when, and I say, when, not if, Roe versus Wade is overturned, we're going to start seeing women locked up. There was a case just a couple of days ago in Texas where a woman who had a miscarriage was arrested for homicide, and there was a national outcry. Nobody really understood exactly what statute she had been arrested under, and the prosecutor ended up saying that it was all a terrible mistake. And I think that's true. The prosecutor didn't understand that abortion is still not homicide in the state of Texas. But soon it will be, and prosecutions like that will be much more enabled and much more common. And this obviously is going to affect, women who are seeking abortions. It's going to affect rape victims. Something that I think is, again, going to be new about this new stage of post-Roe America is that pre-Roe America gave a lot of latitude to doctors to say, that an abortion was indicated. And post-Roe America, we've had in general, we just don't have the same sort of trust in professional authority, right? There's much more desire to sort of regulate things legislatively. And so you have that coupled with a real moving away from rape exceptions as the sort of conservative baseline position, right? I mean, that used to be, not that long ago, there was a primary, or there was a Republican Senate candidate, Richard Mourdock in Indiana also, who, because he didn't believe in rape exceptions, this was seen as, so extremist. It's part of the reason why Republicans, sort of lost what was seen as a very winnable Senate seat. But what was once the kind of median position has changed as the party as a whole has moved in right. So now you have laws being passed, in Texas and a number of states that no longer have rape exemptions. As the party itself has sort of, there's a lot of internal incentive for people to kind of outcompete each other in their fealty to conservative Christianity. So there's going to be these criminal justice implications, but there's also going to be health implications. There's going to be health implications for women who seek abortions, and there's going to be health implications for women who have miscarriages and, go to the doctor and find that, well, let me actually back up. There's going to be health implications for some women who have miscarriages. Women who have good private insurance, who have, close personal relationships with their doctors, I think are probably going to be fine, just as women who have money will be able to procure abortions in most circumstances. What you'll see is that women who go to underfunded hospitals in conservative areas, women who are seen as sort of untrustworthy by medical providers, they will see the decisions that they made in pregnancy kind of litigated, and doctors or nurses or other people who work in the hospital calling the police. So you're going to see people, I mean, in that situation, if I was having a miscarriage, I would be reluctant to go to the hospital if in a situation like that. Now, I talked about things that are going to be worse. One of the things that will be better and different is that we now have medication abortion. And already that's how most first trimester abortions in America are done, is through medication. And so, I think you won't see as many women as in the past seeking medical care for the kind of classic case of the coat hanger, although I'm sure that will still exist. But, women will procure the drugs either, you can often get them through the mail. There's groups like Aid Access that will send these drugs to you if you're in a place where abortion is heavily restricted. So women who understand what they are, who have some internet savvy, who have some medical savvy, will in many cases be able to get these pills. They'll be able to manage the abortion at home. In that sense, it will be safer for them. But they will by no means be out of jeopardy. In some cases, medication abortions are really safe, but in some cases there is excessive bleeding and you do have to go to the hospital for follow-up. And, that would be a very perilous thing to do in a state where you've just committed a felony. There's also a lot of efforts to restrict the sale of, or to restrict the prescribing of these medications so that, just to sort of surgical abortions are only going to be available in some states. In some, medication abortions will only be legally available in some states. And we're going to have, we already have a very, very polarized and kind of bifurcated country, but I don't think we've ever seen something like what is coming down the pike, where you have vastly different legal regimes in different parts of the country. Women who have means will always be able to leave states where abortion is restricted and go to states where it's not. But that's not really the end of the story. There's a bill in Missouri right now that would create a kind of Texas-style bounty system for for people in Missouri who cross state lines to get abortion, and for anybody who helps them. And so the enforceability of this, I think we don't really know, and it's up to the Supreme Court. So whether it's a case of law or politics is difficult to say, but there's going to be a lot of efforts to make sure that people who live in conservative states don't have access to the legal regime of the more liberal states, on the coasts. And this is going to be a very, if you can imagine a regime where, people in Missouri are suing doctors in California, or are suing, kind of abortion funds in New York. Oregon has just allocated millions of dollars to help pay for abortions from people coming from out of state. So you're going to have, these kind of Civil War level, not quite Civil War, that's an exaggeration, but not since the Civil War will we have seen, such disparate and kind of clashing state legislation. It's not clear, though, that the anti-abortion movement will be satisfied with that kind of regime. I think that there's a perception that if Roe versus Wade is overturned, that the abortion wars that began a few years after its passage will somehow be resolved. That's certainly been the argument from even people who believe in abortion rights have sometimes made the argument that Roe versus Wade, by creating a sort of one-size-fits-all legal system, has engendered all this conflict, and that when you can have conservative states have conservative laws and liberal states have liberal laws, it will enable this issue to be like a little bit depolarized, that it will enable some kind of civic peace. I think that's pretty unlikely, and that's not what the anti-abortion movement is planning. The anti-abortion movement has said time and time again that when Roe versus Wade, that the end of Roe versus Wade is the end of the beginning, right? That's when the kind of next phase of the work starts. The next phase will be efforts to enact some sort of national abortion ban. There's people who believe that the Supreme Court could declare fetal personhood by fiat. I think that that's unlikely, although other things that I have thought unlikely have come to pass in the last few years. But more likely, I think, is that a Republican trifecta, Republican president, or Republican Congress would pass a national abortion ban. And because of the structure of our politics, because we as we've seen, a Republican candidate doesn't generally need a majority of the vote to become president. We're heading towards a situation where 70% of the country controls 30% of the Senate, and vice versa. So, the Senate kind of entrenches minority rule. We've seen the way that gerrymandering can entrench minority rule, both in state houses, but also in the House of Representatives. I just came back from Hungary, which has been in many ways a model for the American right. It's kind of a hybrid regime. They call it competitive authoritarianism, where They have elections. You're free to, the opposition can have rallies. The government and their allies own pretty much all of the mainstream media, but people can put up websites. And so it's not, it's not as repressive as some countries that you've been to, but the opposition candidate, had never been invited to appear on any television channel. And the ruling regime, the Orban regime, had in the last election, I mean, they did very well, and they genuinely got more votes than the opposition, but they still don't need a majority to govern overwhelmingly. I think that in the last election, they had 49% of the vote, won them 2/3 of the seats in their legislature. And so you can do things like that with gerrymandering. And I think that, I don't think we're there, but I think that is where things could credibly be heading in this country. Now, in the past, the argument, in the past, the greatest argument against abortion restrictions has been, both in this country and in other countries, has been their effect. Once abortion is illegal, once real women are either going to prison or going to hospitals, once people start to die, you'll see sort of pressure mounting for some sort of change. And so I think that the question now is whether that's what we're going to have to wait for in this country before there is some sort of reaction. We've seen a lessening of political activism, a kind of dampening of political enthusiasm among progressives, among people who support abortion rights. I think it's obvious why that is. I mean, if you remember the Women's March and the just kind of explosion of work that people threw themselves into after Donald Trump was elected. I remember being at the Women's March and meeting these people who, had never been to a march in their lives, had never been to a political meeting in their lives, certainly didn't know what like a precinct captain was. And then all of a sudden they were so horrified that their entire lives became politics. They had entire new social worlds. Some of them would tell me that their husband would say to them, I don't even know who you are anymore. But you can only keep yourself on an emergency footing for so long, and people kept it up for a really long time, right? People kept it up. They kept it up through the midterms. They kept it up through a pandemic. They threw themselves into the final objective of removing Donald Trump from office, and they did it. And they did it, and things are still really bad. And so I think, what you see is that people, for their own mental health, have had to retreat a little bit. It's very, very difficult to stay engaged in politics if being engaged in politics feels just like bashing your head against a brick wall day after day after day. And so, there's also, I think, genuine disappointment. There's people who had very high hopes for what a Democratic trifecta would look like, but there's also just a huge amount of exhaustion. And so there's a real question, I think, about what it looks like the day after the Supreme Court overturns Roe versus Wade. There's still I think there's a lot of people in this country who can't imagine it, right? Most people in this country were born after Roe versus Wade was decided, or at least were small children when it was decided. There's still people in this country who remember what unsafe abortion looked like, but most people don't. And people grow up taking right for granted and kind of can't quite imagine that it's ever going to be gone. And so there's some question about, the day after Roe versus Wade is overturned, is that like the day after Donald Trump was elected in terms of, kind of creating a shock among people who thought they lived in one sort of country and then wake up realizing that they actually live in a very different country. Does that create a sort of political momentum to claw back rights that people hadn't realized they had to fight so hard for? Or does it just create a kind of fatalism as people who feel like they don't have any more avenues of change, withdraw into themselves, at least for a time, at least until there is some horrible case that galvanizes them and brings them onto the street and creates momentum, for a new movement. The anti-abortion movement, including, my colleague Ross Douthat, who's very, very opposed to abortion. And we used to have a podcast together called The Argument, where we would argue about that and other things. And he had a line that other people in the anti-abortion movement often say, which is that they don't want abortion just to be illegal. They want it to be unthinkable, right? They want it to be kind of completely outside of social acceptability. And they're never going to get there, because there is no society on earth where where abortion is unthinkable. And in fact, what we've often had is a pattern where the countries where abortion is criminalized, in many cases, have had some of the highest abortion rates, for obvious reasons, because kind of criminal abortion is often accompanied by limited access to contraception, by stigma around sex education, by sort of not doing all of the things that you would need to do in order to let women control their reproduction. So what this means is that the anti-abortion movement is never going to be satisfied. They're going to, whatever happens, they will be jubilant the day after Roe is overturned, but they will then start to, there will then be a new crusade. And so, yes, the fight, one phase of the fight that people have been fighting for my entire adult life is about to come to an end. And there's going to be like a really scary period, I think, in between, as people figure out what that means. People are already, there's underground networks of midwives and doulas and other sorts of providers, figuring out how to perform abortions, both, manually and with medication. There's going to be, a lot of resistance, but there's also going to be a huge amount of suffering. And so I'll leave it there. Thank you. Should I come here?
Okay. Back on, right? Okay, great. Thank you so much, Michelle. I know, like everybody here, I have a lot of questions, and I'm after listening to you, and I'm eager to talk with you. And what I'm going to do right now is invite Alison Norris and Maria Gallo up for our panel. These are two of our College of Public Health's incredible experts in sexual and reproductive health. And they are part of the Ohio Policy Evaluation Network, or OPEN, which is a project that we're quite proud of. OPEN is a research collaborative, and that was launched in 2018 to study how policy affects reproductive health and equity in Ohio and surrounding states. OPEN conducts rigorous, impactful, and forward-thinking social science research in the reproductive health of Ohioans and people in nearby states. So welcome, Maria and Alison. I think you've each got your, are you sharing a mic? Okay. So what we're going to do, I'm going to sit up here and I'm going to ask the first couple of questions while you formulate the questions that you want to ask. Misty Crane is looking at questions from our online audience. I'm going to let you get that out of the way before I launch in. So that was a sobering analysis, and of course I've read your work before, and you made the case quite clearly that pre-Roe in your estimation is going to be worse than.
Right. And I don't want to act like pre-Roe was so great. It was not great.
No, that's right. And that's why it's sobering. So for those who believe in the need for equitable, decriminalized access to abortion, this is a really disheartening and scary moment. It's a scary moment for women who are following these debates. And I was struck by your discussion about both exhaustion and what's it going to take. Is it going to take waiting for people to understand what lack of access is? Is it going to take waiting for people to die? But what I want to ask is, what can advocates, researchers, and policymakers do to push back on these increasingly restrictive laws?
Well, I think you can run for local office. You can run for, the one thing that the opponents of abortion have done very, very well is focus on state houses, have focused on kind of local office, and Democrats and people who care about reproductive rights just haven't done that as much. To some degree, they've been complacent. They've had the Supreme Court to protect them, so they've been able to, they've been much more nationally focused, right? Every election becomes, we have to keep the presidency and we have to keep, Congress, because otherwise Roe versus Wade is at stake, and that was all true. But that battle, I think, is probably lost, and the battle now is going to be in the state houses, and there are gradations of badness that you can have in the state houses, right? I talked before about the abortion bounty law in Texas. There's a version of that that's been proposed in Ohio, and so you can both, get involved in trying to flip Senate, in trying to flip state house seats, and in also trying to, in places where those seats aren't flippable, to try to, choose between bad and worse. But I think that, there has to be a focus on local politics right now.
Great. And so do either of you want to add to that question? If not, I've got a follow-up question for both of you.
Let you have your follow-up.
Okay, then you can pick which question you want to ask. So as we move into this period, what's the most important data for us to be tracking and keeping our finger on the pulse of? Is there research that we need to be thinking about continuing? Is there new research we need to be thinking about launching?
Sure. So thank you, the organizers. Thanks everyone for coming out. It's heartening to see people paying attention and caring about this issue, so thanks. I don't know that this is the most important, but I will say a thing that we should be measuring. So when Michelle was talking about how post-Roe isn't going to be the same as pre-Roe, it will be worse. I think she's exactly right. And we know this also from looking at places where abortion is illegal and people are criminalized for it. So I started off my career by working in developing country settings and low resource settings where abortion is illegal. And when you go to a clinic where this is the case, there is a chilling effect on a clinic because there isn't trust between providers and patients. Providers question, are people in the staff going to report them? If they don't report a person who came in had abortion complications, people don't want to go in, because if they go in, are they going to be, someone going to call law enforcement on them? Are they going to end up in prison? So it's a very scary situation. And it's exactly what Michelle said, in that people who have money will go to private places where this isn't an issue. And other people, it will be applied unevenly, where other people will be will face these risks. So I think one thing that's important to do is to document the harms that come from these changes in laws. To document the harms, like how is this affecting people? How do they feel about going in? Does it stop people from going in and getting needed care? Do they not go in when they need care? Do they go in and they don't get the care they need because they can't talk honestly with their provider and tell them what happened? And how is it applied? Is it applied unevenly? We know that it will be applied unevenly by race and age and SES. Like, we know all these factors, but documenting it so to push back on what's happening.
I agree very much with Maria. It's really delightful to have so many of you here in person and so many of you joining us online. So thank you very much. And thank you, Michelle, for your remarks. The work that Open is pursuing is indeed to generate data to document what's happening. Because we're talking about once the decision comes down about Dobbs and how the Roe decision will be impacted and how that will change access to abortion across the country. We're also experiencing a reduction in abortion access here in Ohio now and have been for years and in many states across the country. And that is the mission of Open, is to say, what are the consequences of the laws and policies in Ohio and Kentucky and West Virginia on the health and well-being of people in the state? And we hope those data will be useful for policymakers and healthcare providers. And to the degree that they fall on deaf ears, the goal of the work is to not have it be invisible, not have these harms just happen quietly in the lives and cause desperately bad outcomes in lives of people who don't have any way to talk about it. And so the very work of doing the research and creating that evidence and putting it out there is, in some ways, what we as researchers, that's our tool we have to say, like, we won't just let this happen invisibly. We will continue to tell people and document what's happening.
Can I say something quickly about research that's been helpful for me as a journalist, and I know that's been helpful for other people? I actually meant to mention this earlier, is the Turnaway study. This was, some of you probably know about this. They basically, clinics looked at women who had come in either just under or just over the gestational limits for abortions in their states, which can be different in different places. So you could measure basically somebody who was able to get the abortion they were seeking or was forced to continue on with their pregnancy, which is going to be a even more common occurrence in the years to come. And you can measure, one of the arguments that the anti-abortion movement has made is that this is all about helping women, that they regret their abortions, and who regrets a child. These studies don't measure regret, but they do measure other sorts of outcomes. They measure anxiety, depression, financial well-being, ability to take care of your existing children, since most women who have abortions already have children. And what they show is worse outcomes for people who are denied abortion. And it's just, I think in the political arena, it's helpful to be able to, refute, I think, some of the romanticism of the anti-abortion side about what the world that they're creating is going to look like.
Thank you for that. And the one thing I wanted to add is this, thinking about from our context in Ohio and the ways in which Ohio is already, or people living in Ohio are already experiencing many of the restrictions that are sort of imagined in a post-Roe. So we have a gestational ban that is pre-viability, pre-viability, so prohibits abortion when it should be protected by Roe. And we have bans where people can't get abortions if they tell the people who are providing it that it's because of a Down syndrome diagnosis. So already we see some of these things in place. And the concern I have when you raise like the fatigue that people experience is that like these laws are already in place. Mm-hmm. People are already suffering from these laws. Of course, we see in Texas, people are already experiencing the consequences of those laws. There isn't protest in the street. And so the fatigue is operationalized right
Right,
now.
right.
And so
Yeah. And I would love to hear the three of you discuss some more of those blurry boundaries. On the one hand, you could, maybe there's a bright line once we have the Dobbs decision, but there may be this muddy middle. But what's going to be less clear and more complicated? And certainly, Michelle, you hit on the idea of miscarriage, and that gave me a new appreciation of the ways in which miscarriage will be interpreted and maybe read differently with different populations who present with a miscarriage. What else is going to be more complicated, less clear, muddier post the Dobbs decision? And whoever, and Michelle, we'll pass it back to you to start.
Well, pregnancy. I mean, all kinds of, pregnancy, IVF. I have a good friend of mine, and she wrote about this, otherwise I wouldn't be sharing this, was pregnant with twins, had been shocked and then excited, and then found out that one of the twins wasn't viable. And by continuing with the twin pregnancy, she was threatening the other one, right? If she went into early labor because, her body was trying to miscarry this unviable pregnancy, she risked both. And so she made the really painful decision to abort one of the twins in order to be able to have a healthy pregnancy with the second one. I think people who have never thought of themselves as having anything to do with abortion, right? People who, in some sense, many people, who have abortions sort of never really thought about it until, there was a saying in the pro-choice movement that everybody believes in 3 exemptions, rape, incest, and me. But people who, really never thought that any of this applied to them are suddenly going to come kind of face to face with what it means to have these decisions, legislated out of your hands. And it will make, a lot of decisions that you make during a pregnancy much, much more fraught.
Yeah, I'll just add to that. I think one thing is that when you talk about fatigue, yes, I'm sure there's some fatigue, but another thing where I think this will be different than other changes in law is that it won't hit people immediately. Most people are supportive of abortion. This has been consistent over time. It's a small minority that is opposed to it, but most people, it doesn't really affect you in a day-to-day life. It affects you when you need it. And so you're not thinking ahead, you're not planning ahead, you're not thinking about it. And many people haven't really thought through what this means. I did a paper when I first came here with a master's student where she measured the frequency of people who thought that abortion should never be legal among abortion patients. So there were people getting abortion and it was not 0. There were people who were getting abortions but thought it should never ever be legal. And so that, we're not always logical thinkers. We don't think things through logically always. And so I think that's part of it, is that I don't think that it's going to hit people. I don't think we'll see massive protest because it doesn't hit you until you need it. And then you realize that it's not there. Currently, just to add on to what Alison said, we've already stripped away lots of ability to access abortion here in Ohio. And there's been some pushback, but it's not, people aren't in the streets about it. We have almost 30% of the hospital beds in Ohio belong to a Catholic hospital, which does not allow abortion, even if the woman's life needs it. The person's life needs it, whoever's pregnant, that pregnant person, if they need an abortion, maybe they have a ectopic pregnancy and it's critical for their health to have an abortion, they will not perform it if they're following the Catholic ethical directives. And so there've been cases where women suffer lifelong consequences because of that, because they can't get care. But people don't know this. You don't know it until many people attending Catholic hospitals don't even know that's the Catholic hospital. So they don't know that they're not going to get the care that they need. And so it's harder to push back against it when you don't even realize that that you don't have a right to this.
I wanted to add on 2 other things that are murky and muddy. One is what the clinics themselves can do. So it's this idea of abortion care churn, where the clinics, and this happens now all across the country, this idea of care churn is happening. where clinics themselves are subjugated to changing regulations and impositions from departments of health and laws that are passed and then enjoined, and then decisions are made and they're enforceable again. And so the clinics themselves have an inconsistent ability to provide care or even clear information about what's going to be available in the coming days. And so that uncertainty will only increase because the number of laws that are passed and then enjoined and then debated in the courts will continue to increase. So that experience of the clinics, the providers of the care having less clarity on it. We see it at the level of the healthcare. That's the clinics. We also see it at the level of the healthcare workers, also not being clear on what they are permitted to do and say and provide.
Can I say something quick? I do think, I mean, in terms of what you're saying, like, obviously you're right. You know, there's been like a long sort of like frog in the pot impact. I do think that Roe versus Wade overturned headlines is going to be kind of galvanizing, because one thing that has, or at least I hope, because one thing that's happened so far is that, you know, these restrictions have been incremental. Some of them are really hard to understand, right? Some of the most kind of consequential restrictions are so boring to talk about that, like, it makes your eyes bleed to talk about these targeted regulation of abortion provider laws that, you know, mandate the width of a hallway. And, you know, they do various things that sort of make it very bureaucratically untenable to provide abortions, but are very, you know, they're not emotional to talk about. They don't. And so, you know, and I think that's part of the reason that those laws have been so successful. You know, but then occasionally you will have, you know, Mississippi had a fetal personhood law that people realized was going to, you know, not just kind of criminalize all abortion, but was also very likely to criminalize IVF. And there was a huge uproar, and it was actually defeated in Mississippi. You know, so there are certain sort of political bright lines. It's one reason that for a long time people thought that the court wouldn't try to overturn Roe. They thought that if you really just want to erode abortion rights in America, the smarter way to do it is to leave Roe as a sort of shell while you, you know, kind of take away most of its substantive protections. You know, we'll see, but I do think there's just something different potentially about the starkness of it.
So do you see that as a serious threat? So we were talking about Roe, but of course we had Griswold v. Connecticut first, which was the birth control decision, allowing women in a marriage access to birth control. Do you see, are you imagining that the ambitions of the movement will extend also to beyond IVF? What's the limit, the realistic limit?
I think, I mean, look, I think that right now there is no political appetite for a ban on birth control. I mean, you could imagine certain restrictions on the birth control pill, certainly on Plan B, you know, which I could imagine being severely restricted. I tend to think that the more immediate threat, it's not exactly reproductive rights, is to Obergefell, the gay marriage decision, which, you know, also has some of the same legal underpinnings of a right to privacy, and is something that has been spoken of. You know, I believe Senator John Cornyn spoke of it when he was talking about kind of decisions that where there was judicial overreach. And, you know, and you're seeing right now in this country, it's very shocking to me as someone who thought, you know, I was in Ohio in 2004 covering the presidential campaign where where there was this huge campaign against gay marriage that was like very animating, and that, you know, probably not, it wasn't even just about gay marriage, but about gay partnerships as, you know, recognitions as well. And then that really seemed to kind of fizzle away. It had felt, at least to me, like there had been some sort of cultural truce. You know, the Republican Party realized that it was a losing issue. Public opinion had shifted very dramatically. But suddenly you're seeing a real resurgence in homophobia with all this talk about grooming and gay, you know, teachers who come out to their students. And so, yeah, that would be my guess for sort of the next domino. I don't know about you.
I think that's a good guess. I don't disagree with that, but I want to go back to what you said. I mean, I hope you're right and I'm wrong, and that if Roe were overturned, there would be an outpouring of pushback. I hope you're right. I'm a little bit more skeptical. We have as part of the Open Project, we have a population-based survey of women in Ohio. And we asked them whether they think abortion is currently legal, and 10% thought it was illegal. 26% said they had no idea whether it was illegal or not. And so you've got over a third of the population that's unsure about the legal status. I'm not sure that, that group is, there's lots of people who are not paying attention, and maybe overturning it would be this dramatic thing that would force people to pay attention. I'm not convinced.
And as you can of course go back to any question, but as you think about that, I do want to think about not just what people don't know, but actual misinformation and disinformation. So we're in this period of time in which risk perceptions are unmoored and distorted, and we're all very familiar with the disinformation campaigns. And I use disinformation very deliberately. Some of it's misinformation, but there's also deliberate attempts to distort the truth. So what's been the role of misinformation, disinformation, lack of information prior to this moment? Is that going to change post, or is it going to become very clear after that headline?
Well, maybe you're right. It will become very clear, but I think the misinformation is by design. So we saw that not only are people unclear about the legality of abortion, but it changed over time when there's this introduction of laws that it's confusing. Legislation is proposed, it's passed, it's enjoined, so the governor comes, vetoes it. It's a very confusing process. And I think it's partly by design to make it confusing so that people don't know what it is that they can ask for. Also, to go back to all these trap laws, it makes it difficult for the provider, because who wants to do something where if you're facing possibly 10 years in jail or $100,000 fine, which is the latest, that's been proposed in
And just
Oklahoma.
remind us what a trap law is.
Yeah, the targeted regulation of abortion providers. So it's by design to make it confusing, so that people end up self-censoring. So they self-censor they stop themselves from what they do because they don't want to go to jail, and the law is confusing. It's confusing where we're at. And so I think misinformation plays a huge role, and I think it's baked into it. It's part of it by design.
There's another piece that is maybe less intentional and also very, very deeply embedded, which is stigma. So abortion is a very stigmatized procedure, and it's sort of, for a lot of deep reasons about how people think about sort of the ideals of motherhood. And so an abortion is in some ways a rejection of the ideals of motherhood. At least that's where some of its roots of stigma are held. And so when you have a very stigmatized procedure or healthcare, people don't talk about it. They don't talk about it in the same ways. They're not willing to say, oh yeah, I'm in favor of that thing. Or
I had that thing, and it was fine, right?
And it was fine. People in, for example, we know from that people in rural parts of the country and in Ohio use abortion at much lower rates than people in urban parts of the state. And part of that is this combination of misinformation intertwined with stigma. You'll believe misinformation if you have no ability to kind of talk about it and push at it and understand it better. So I'm not sure it's sort of as intentional, although of course the use of stigma to perpetuate some legislation is intentional, but there's a nefarious part of it that is pervasive throughout places where there's no intention behind it, which in some ways is more insidious because there's not something to undo as directly.
Michelle, do you want to add on that question?
Well, I think, in terms of disinformation, we have sort of mandated disinformation in many states where, you go to have an abortion and the doctor is, legally obligated to tell you things that are either dubious or flatly untrue, right? They have to tell you that abortion is going to increase your risks of breast cancer, that it's going to, I think in some cases, increase your risks of mental illness, I believe, right? So they kind of give you this spiel that is often untrue, but they, there's something very insidious in terms of the trust of doctor-patient relationship and enlisting doctors to give people untrue information. I wonder if the next step in that, or the sort of next turn of the screw, anyone who's, I'm sure you've seen the effect of the global gag rule, working in other countries. This has been usually when Republicans are in office, they institute this rule that basically bans American, groups supported by American aid funding from, referring people for abortion, talking about abortion laws, telling them that abortion is legal and available if it is. You could imagine something similar in the aftermath of Roe, where, sort of doctors are no longer able to even, not only can they not perform abortions, but you could imagine laws that are attempting to restrict what they can tell their patients about, where to get one elsewhere.
I'll just say, that sounds like impossible. How could they do that? But then we see that they're trying to restrict what we currently teach in the classroom. And so no, it's not actually that far-fetched to think that that would be a strategy.
So let me, so I'll give Misty the heads up. This is the last question I plan to ask. So I think you made this point earlier when you were talking about the potential impact on other issues on gay marriage. So talk a little bit more about the degree to which this may have broader implications beyond abortion, women's reproductive rights, women's health, and to what extent might this be serving as a playbook for other issues? What are they? What are the specific fears you have around those issues? And to me, that's one of the things that makes this, whether abortion is your issue or not, it makes it important to think very critically about abortion and its implications, and begin to draw the connections and see the connection to our current context.
Well, I think, again, the right to privacy, which was, the sort of idea at the core of Roe versus Wade and of Griswold versus Connecticut before it, is something that we all now completely take for granted. And if the Supreme Court says that doesn't, that no longer applies, you can imagine, all sorts of, well, I think we don't even have to imagine, right? Like you're seeing restrictions right now on, kind of care for transgender adolescents. You could imagine some of that extending to, either extending further to adolescents, but also extending to adults. I think that in terms of women's rights, it creates just like an entire locus of control where, your sort of body is always the site of potential wrongdoing. There's this proposal in Alabama that says that anybody getting medical marijuana any woman getting medical marijuana has to show a negative pregnancy test, I think if you're up to 50. And, in some ways this is, not the most important issue in the world, right? But, it's kind of ridiculous, but you just imagine that, all of the things that you're going to have as a woman that you have to kind of justify, that you have to prove yourself unpregnant before you do. I mean, think about, I don't know if you've been pregnant, how many things you're told not to do. People tell you, don't ride a bike, don't, go on a roller coaster, don't eat sushi, don't have coffee, don't have, so you can imagine a regime where you have to kind of justify yourself at every step. And I don't know that the anti-abortion movement is necessarily dreaming of a world where you kind of have to constantly, show your papers before you access any sort of treatment or service. But that is the logic of it. And, all people just, once kind of a woman's reproductive capacity is seen as something that's sort of publicly owned or a matter of, public concern, there's sort of no end to the potential for interference.
I'm so despite this conversation and what I work on, I'm like a deeply optimistic person. And so it's actually this question about, so I think so much of the legislation that we see passed is disingenuous, right? It's not really people caring about the personhood of the fetus. It's about people wanting to win re-election in a place where they have to run to the right of other people. And so, so that disingenuity, it can be exposed in the way that this discussion about abortion is really about bodily autonomy, as you've just described so clearly. And so are so many justice movements. So the Me Too movement is about having bodily autonomy, about how your body can be touched by other people. The Black Lives Matter movement is about the just right to have your body be safe in the world. And so the optimist in me sees these things coming together and the power of these different movements that people care about differently, but that they have this sort of similarity, which is there's a human just movement for being able to have your own body be controlled by yourself and not by other people.
Alison and I work well together because I'm the pessimist and the cynic. I look at the same situation and I just say, this is political expediency. We had a president who was pro-choice and then became anti-choice once it was no longer convenient. And I see that this will always be part of this tension, right? Because you have to be opposed. We have two parties, and so they have to have some distinction between them. Roe versus v. Wade, if it's overturned, they're just going to change the goalposts, move it further down. I don't share your optimism that they won't try to restrict contraception. People are already describing certain contraceptive methods as abortifacients, already saying getting an IUD is that's equivalent to having an abortion. They're already moving it. And so it will be a constant tension because the way our system's set up, we need this. We think we need this. So if it's not contraception, it will be, overturning gay marriage. That will be the goalpost. It will be pushing back against racism. We see what's happening. And so I don't share your optimism, but I appreciate it.
I'm right.
And I see Misty is up here, but just one last wrinkle here. So you described it as a bounty. I see it also in terms of citizen surveillance. Do you see that having applications in other areas? I don't know if that's an aspect of the new Texas law criminalizing pulling parents in for child abuse investigations if they give their child access to gender affirming care. Is this, and of course citizen surveillance has played a very different role in the Black Lives Matter movement. So I want to think about, it's a complicated.
I think the creation of a sort of vigilante society where certain people are given the authority to surveil other people with sort of lesser categories of rights is, so one frame for looking at this whole thing. And Texas is obviously one example of it. Kind of stand your ground laws is, and this people who are allowed to stand their ground is another part of it. This new legislation in Florida that people have been arguing about, the so-called Don't Say Gay bill, is also has, it's a private, a private right of action. And so I've had arguments with conservatives who say, well, this is really just about, nobody's actually going to interpret this, that you can't, mention your, that a female teacher can't mention her wife, or male teacher can't mention his husband, or, my daughter's in second grade, and recently when a trans girl transferred into her class, I think because she was transitioning and wanted to be in a class of people who didn't know her by the name that she used to have, the teacher, these are second graders. The teacher didn't give them a whole big disquisition on transitioning, but she basically said, so and so is going to be in our class, and she used to be known as X, and she's and she's a girl, and we treat our classmates with respect. And somebody who was in favor of the Florida law said, well, of course that would be allowed. But in terms of who decides what's allowed, it's people bringing lawsuits because they believe that it was violated, because they believe that this law was violated. And they have every incentive to read it in the most restrictive way possible because they can get a bounty if they find a sympathetic judge. And so I think, again, the chilling impact is going to be, about as wide as your imagination is.
All right. On another sobering note, Misty, you have some questions that are coming in from our, and so as others are ready to ask questions, please queue up behind Misty.
Please do. I'll start with a question from our remote audience. Thank you for joining us, everyone. So Jesse Hill asks, Michelle mentioned self-managed abortion with abortion-inducing medications that can be obtained online. How realistic is the possibility that a large proportion of people will be able to use this alternative abortion option post-Roe? Do we have a large proportion of folks needing abortions who will have the savvy, know-how, funds, internet access, et cetera, to use this method?
I mean, to some extent, this just sort of depends on how much the word gets out and how much, and sort of both how much people know that this is an option and on the legality of it. Like you can get pills from Aid Access right now if you're in a state where you worry that this could be, that not just abortion, but the procurement of abortion pills could be criminalized. You can get them and save them for a rainy day. But obviously, that's, I think, something that is probably not known by even most sort of politically attuned people. And so, one of the challenges for the abortion movement in a kind of post-Roe environment is getting the word out to people, about how you get these pills and how you use them.
So that can feed back into the first question about, well, what's to be done for people who are distressed, concerned, and you're talking about getting the word out. Reminds me, you probably read the piece by Jessica Bruder in the Atlantic,
Mm-hmm.
and she wrote, no matter how the word is passed, more autonomy is coming, at least eventually. A post-Roe world will not resemble a pre-Roe world. And I think it made the difference between you and Jessica, as I read this piece, may be a little bit like the difference between Alison and Maria.
And you're talking about the piece about self-managed, about the kind of underground, right? And so she, it's a really great piece. And so she talked about, in addition to pills, kind of collectives of people who are, what is it called? The Carmen cannula. Basically, people who are innovating on these kind of homemade abortion devices, which were often used in developing countries, for a long time, and were used in America pre-Roe. They were kind of euphemistically called menstrual extraction devices, which you could, if your period was stuck, you could use one of these devices. And there's people who are, I think they seem to be relatively technologically simple, and there's people who are making them and passing around instructions, and training each other and using them. But again, all of this, especially in an environment where it's criminalized, requires, a certain amount of, it's both dangerous, even if it's not medically dangerous, which it is if you're in the wrong hands. There's like the legal danger, and just it requires, a kind of certain amount of savvy and connection.
And that disproportionate burden that we've been talking about, it just plays out in all of those spaces. So the consequence of it, something that's illegal or questionably legal, or hard to find or hard to know about, those disadvantages fall the heaviest on people who have already the most structural disadvantage. And so.
And I think it'd be good. We've talked about structural disadvantage inequities in a broad way. disparities. Can you maybe drill down a little bit into what we're already seeing and what might deepen?
Well, I mean, if you look at the women who've been imprisoned right now for, for either, kind of quote unquote fetal homicide, or, the woman who was recently arrested for a self-induced abortion in Texas, right? These are usually people who are already somewhat marginalized. Often they have people who've had late abortions, either haven't had the money or the access to get one earlier on. And so I think it will just, again, it magnifies these questions, both of these kind of intertwined questions of resources and of knowledge, right? I mean, it's both expensive, although, kind of getting a medication abortion through the internet is, kind of less expensive than getting a surgical abortion, but it has to be done, usually within, I think, 10 weeks, correct? And also just, Sabby, you talked about, 30% of people sort of being unsure of whether or not abortion is illegal. And so, when someone who's in that 30% gets pregnant, there's probably, I would imagine that there's like quite a long period, even if they want to end their pregnancy, of just kind of discombobulation, right? Of kind of not having any idea what steps you take, even in a legal context, to end your pregnancy, much less in an illegal context.
Yeah, come on up to the mic.
Oh, that thing, I don't know the microphone. I just wanted to know relative to the disproportionality of cohorts. Now, I think you just talked a little bit more about ascension of some of the healthcare systems, what are they saying about how this is going to play out in terms of the so, talk about, rich, have, so that's one cohort, several cohorts. What about that cohort is right over there? That has how is this for those previous problems and Alison, so that things trying to figure out what.
I don't know if you want to take that. I mean, it seems so. Honestly, I'm having a meeting with someone tomorrow because one of the things I'm sort of trying to figure out is what people are doing to prepare for this new world that's kind of coming rapidly down the pike. And in some way, I don't really actually know that much about what people are doing besides what they're doing to kind of prepare for the actual provision of clandestine abortions, or the provision, like I said, there's states that are getting ready. California wants to, make itself a kind of abortion sanctuary. Oregon allocating this $15 million for people who come from out of state. New York, there's going to be people coming from out of states. I imagine states that border states, Illinois has set up a clinic right on the Missouri border, so that, or Planned Parenthood has set up a clinic right on the in Illinois, but right over the border, so that people in Missouri can access it. But, these are all, whether these are solutions at scale is, I think, something I don't, right? Because, kind of go to another state is, not a solution for people who don't have cars. It's not a solution for people who don't have money, for people who can't take the day off work, right? For people who don't have childcare. I mean, there's any number of impediments. And I think people are trying, like, kind of frantically to like weave this safety net, right? I mean, you have abortion funds, you have all kinds, but it's just, I don't think it's just not enough for the size of what's coming. But in terms of kind of what the hospitals here are doing to get ready, I don't know.
Yeah, I mean, I don't know what the hospitals are doing to get ready. I don't know that it's a priority for some hospitals to get ready for it. I think people are okay if people are forced to carry out a pregnancy that they don't want or isn't right for them. I do think that very few people know about medication abortion. It's a minority of the population. I think this will change rapidly. And to the point, the question that came in virtually, I am optimistic that there will be widespread access to medication abortion. We think about before, marijuana was legalized, anybody could get it. If there's a drug that people want, there will be a way to get it. So I am optimistic that that will increase dramatically in terms of people's access to it. Whether it'll be evenly, whether the access will be evenly distributed is another issue.
What your question makes me think about, Daryl, is the importance of having spokespersons who are not already the people who are the spokespersons for this particular cause. The people who are trying to provide abortion and advocate for abortion in the states where it's very restricted are exhausted. And they're also about to lose their jobs. And so they are, well, they're very, very, it's very hard to imagine that they are preparing more than what they're already doing right now. But big, well-resourced hospitals, this is the time and those folks who know the people that lead big resource hospitals, it's the time to have the conversation with those people. Because in the metaphor of like, if this law now can tell people who provide OBGYN care that they cannot terminate a pregnancy in a patient for whom they need to terminate a pregnancy for that person's well-being. And then tomorrow it's going to be the endocrinologist who can't provide care for the transgender person who needs that endocrinology. It just keeps coming. And I mean, even you don't necessarily have to be motivated by self-interest, but these hospitals should be.
And they also should be motivated. I mean, I think that the other thing that they need to have policies on is about reporting, right? I mean, because so many, like again, this woman in Texas, she was reported by her healthcare provider, and there should be, if you're not going to get kind of laws passed to protect patient privacy, you can definitely, I would imagine, have internal policies about protecting patient privacy and not calling the cops on them.
I just say, as long as it's a medical clinic and not a crisis pregnancy center, which we've done some research in, and which people in Ohio often attend when they first find out they're pregnant. You can imagine a situation where people are going there to get a pregnancy test, and then all of a sudden, these places, which are not medical facilities and have no sense of responsibility to keep information private, would instead be reporting them to the state. That's a very chilling idea, and I think it's very possible that this will be happening.
Abby, you want to add a layer on here for us?
Yes, actually, it's a slightly different question. So is this on? Can you? Okay, perfect. So I'm wondering, I'm thinking a lot about, I should say I'm an epidemiologist. I work with these two, and I'm part of the open research program. I'm really thinking a lot about this idea about optimism or pessimism about the day after. Will people have this marching in the street, or will they be the frog in the pot? And I'm wondering, especially as a person coming from the media, if you can reflect a little bit on this power of the anecdote, power of narrative versus power of rigorous population level data that is published in scientific journals. We have a Supreme Court that is sort of explicitly rejecting of research in favor of anecdotes and folksy stories at points, right? And so it seems as though our group and many others are putting a lot of time and effort and energy into putting that out there. And it's not clear that it's breaking through. Meanwhile, that news story about the woman who was arrested, everybody knew about that news story, right? It did probably a lot more for this raising awareness of this cause than the 40 articles that our teams have published over the last few years. So what do you think about that?
So I think, I mean, from the point of view of somebody in the media, you kind of need both, right? Like it is hard unless the study is something that's like really eye-catching or often counterintuitive, or, I think the Turnaway study in some ways fit this bill. I mean, it wasn't counterintuitive, but it did really answer a question that a lot of people had about, kind of what happens and how do these women fare. And so that itself could be headline grabbing. But, I mean, that like the Stalin quote is often true of the media as well, right? Like one death is a tragedy, 1 million deaths is a statistic. And so, you can kind of tell people, I don't know exactly, it's 1,000 something who've been prosecuted in various ways for like pregnancy outcomes or decisions they made during pregnancy under these various kind of fetal protection laws. But just a story of one person, one sympathetic person is often just kind of necessary to grab people's attention. But once you've grabbed people's attention, you need that data to sort of weave something more comprehensive, right? Like if I'm pitching something to an editor, I can say there was this horrible case in, Indiana or Alabama. But then you need to sort of make the case that it's not just an outlier. Strange, weird things happen all the time that don't necessarily signify a broader social trend. And so, I can imagine that must be super frustrating as a researcher. But that research is all like really necessary to like round out the picture, round out the stories, round out the anecdotes.
Thank you. Marion.
Yes. Well, first I wanted to thank Michelle for coming out here
thank
for
you.
your first talk since
Thank
the
you.
pandemic. We feel honored. My question is probably even more cynical than Maria is. I'm a historian and I'm thinking about how the birth rate is at historic lows. And knowing that in other societies like post-World War I France, terrors and sort of panics about demographic collapse prompted pro-natalist policies, which were also anti-abortion policies. Some, maternal child health care, yay.
Right.
And then no abortion. Do you see in the current anti-abortion discourse with which you're so familiar, do you see this sort of fears about demographic collapse? And do you think it's going to be even more prominent?
So I mean, I think
post-repeal?
yes, I've definitely seen it. I remember, so my second book was about kind of global battles over women's rights and often reproductive rights. And I remember they used to have these conferences, I think they still have them, called the World Congress of Families. The idea was to sort of bring together conservatives and fundamentalists from all different parts of the world who could sort of strategize about global liberalism. Now we see this kind of axis of authoritarianism, but in some cases, this was maybe an earlier iteration of it. At the time, when I went to this conference in Warsaw in like 2008 or 2009, there were so many Russians there. I didn't really know what to make of like the Russian role in bringing all these people together, although later on you could see it. And Russia was actually like a big sort of promoter of this idea of demographic winter, they called it, right? That like, and at the time they was woven into fears about like the homosexual agenda and, but so you definitely see it. I mean, you could definitely hear it in Poland, which has restricted abortion. I mean, interestingly, a country that's very, very concerned about demography is Hungary. They haven't made much move to restrict abortion because it just wouldn't fly. And so I think that because the numbers are pretty clear that like the countries that have, I mean, although Hungary, I think, has nudged their birth rate up by providing like pretty big child subsidies, by exempting women who have a certain number of children from income tax. I think at this point, people like even the conservatives who are really interested in this stuff understand that like the only thing that has worked is like kind of the good kind of pronatalism, the like
Incentives,
right. Even though, they often will oppose, for example, the creation of universal daycare because they would rather just pay women to stay home rather than help them find childcare so that they can get jobs. But there's, I think, some sort of consensus that there has to be like more provision of services, and that countries that have banned abortion just like hasn't raised the birth rate. It just doesn't work. And so there's, you can just, if it had worked in Poland, for example, it might be seen as more of a precedent. I guess you could imagine it turning. And I do think that it is like a sort of background part of a bigger panic over like, you know, the number of children, the number of kids who identify as, you know, something other than kind of cisgender heterosexuals. You know, there's definitely worry about it. And I don't think worry about sort of having replacement level fertility is not necessarily reactionary, right? Like the country would be much better if we had more immigrants and more young people, and, you know, made it easier for people to have children, and, you know, and it would also sort of be economically beneficial to have like certain kinds of age structures. But so again, like I think that like demographic fear is there, and it's definitely there around race and immigration. But I don't see it being used as an argument about banning abortion yet, although I wouldn't rule it out.
All right, thank you.
Were you, Alison or Maria, were you going to weigh in there? Can I just add one wrinkle to that question? Because, and it had to do with the discussion of policies that make it easier for women to have kids. And one of the things I've heard you talk about before is one of the things that people often don't recognize is that having an abortion is a lot safer than having a pregnancy. Do we owe something to women who we're forcing to have, we are requiring to go through a pregnancy that they may not want to have, that requiring to go through a more dangerous procedure?
I mean, you would
Childbirth?
you would think so, but in a way, like, and I feel like there are some people in the anti-abortion movement who will acknowledge that, you know, sort of certain intellectuals who will say, you know, yes, we are demanding women take on this particular burden, but I don't think that they're doing that on any sort of widespread policy level, in part because I just don't think they're willing to recognize on any sort of widespread policy level that this is that much of an imposition. You know, I just want to say, like, you saw Amy Coney Barrett, I can't even remember which decision it was, or it was just in her questioning around Dobbs, where she said something like, well, you know, now you have like, problem solved because you have these like these programs where you can just kind of quickly surrender a baby for adoption, you know, sort of no strings attached. And it was such a, you know, she's a bright person, but it was just such a wild idea that because it's easy, because we've made adoption easy, you know, we're not really asking much of somebody who is forced to give birth against their will.
So I'll just add, since, so to your question, if we acknowledge that pregnancy carries risks, we can also acknowledge that it carries risks that are different. So Black people have a much higher risk when they are pregnant of having maternal mortality or other morbidity. And so if we're going to compensate, I suppose to be logical, we would have to give higher compensation to certain groups. But also, I just don't think the general population realizes that abortion is so safe, that abortion is so much safer than carrying a pregnancy out to childbirth. And we did a study. There was a student who analyzed some data from the Open Project, and one of the Open projects looking at why people think that abortion is safe or unsafe. So sort of qualitative, what are their thoughts about it? And one of the you know, small findings that I thought was just so interesting is that some people said they thought abortion was unsafe. And then when you ask them to explain why, it was because of those people outside the clinic who might like hurt them as they're coming in.
Right. Well, that's correct. I mean,
so protesters make it unsafe. And so just thinking about compensation and how you compensate.
That's a great point to make at a moment in time with there's a lot of backlash against public health, and public health officials are experiencing the same things, election officials, school board members. Please.
Hi, I'm Katie Rivlin. I'm an OBGYN. I'm also part of Open and an abortion provider. I see another healthcare provider here, Emily Neiman, who's a midwife. And something that I am often struck by as a healthcare professional who learned in a medical school, and I'm curious to hear what Emily will think about this, but we're trained to see abortion, miscarriage, and ectopic pregnancy as very separate. They're separate chapters in the book. But in this conversation today, and in conversations I've had actually with Maria in the past, I don't think that that is the way maybe the general public sees it.
And in hearing Alison talk about stigma and these sort of ideals of motherhood, and in hearing you, Michelle, talk about miscarriage and criminalizing miscarriage or potentially criminalizing miscarriage, I feel very conflicted about lumping these things together, right? I mean, I think it could do some work to reduce stigma, because the moment we let miscarriage with abortion, then so many more people are potentially impacted. But I am very fearful to lump them because of all the battles that I fight to provide care for my patients, particularly around abortion. So I wonder if you guys could talk about maybe.
Can you just elaborate on that?
Yeah.
Like, how do you think it will, I guess, negatively impact your patients who are seeking abortion?
I don't just mean my patients receiving abortion. I mean my patients experiencing miscarriage or ectopic pregnancy. If the laws that apply to abortion all of a sudden apply to everyone else, then I'm just like in a much bigger pool of how do I provide care for this patient.
Right, but I think that they will. I mean, to me, that's the thing, is that it's kind of not up to us, right? Like how this is framed. I mean, I'm sure that there's going to be, I would imagine there's going to be exemptions for ectopic pregnancies, and they won't say that there won't be kind of like language criminalizing miscarriages. And it actually probably won't even maybe apply to your patients, because you're not going to call the cops on a patient who shows up, in the middle of, having a kind of miscarriage that they can't quite explain. I think that we already see miscarriages being criminalized in this country. It happens, I think, to a much greater extent in countries where abortion is illegal. And I just think it's an inevitability. And I tend to think it's useful. I think it's important for people, who say, well, I'm not going to have an abortion, to understand that these legal changes are going to apply to them, whether they ever find themselves, even if they never find themselves in the position of wanting to end a pregnancy.
I mean, we've had this conversation before, but I will say, like, I'm not sure in an Ohio setting and maybe some other settings that there is this clear line between an ectopic pregnancy will be okay to to induce an abortion. We've had a
well, in Catholic hospitals, not right. Like,
oh no, across the board, we've had legislation put forth that they should have to take the ectopic pregnancy.
Oh, I've heard about that. Yes,
in the
yes.
uterus. So there isn't clarity here that there is. I mean, I think Katie is raising an issue that there isn't clarity between the different types of care that women might need and the different circumstances that they might find themselves in. We've had this conversation. I mean, I hear what you're saying, but at the same time, to me, it's sort of separating it out, people who, need good care, who justified in needing care, versus people who don't, it's not an ectopic pregnancy, and so they don't need to have an induced abortion. And a lot of this is cultural, right? It's cultural how we think about it. And from your training, you were taught in a way, and so to you, it's very clear, but some of these things, not to get all anthropology on you, but but this idea you raised earlier of it's a common belief in some countries that there's this process you go through for menstrual regulation, which is an abortion. In our culture, we would call it an abortion, but they're convinced it's not an abortion. It's not.
It's bringing on a late period. Yeah.
It's just bringing on a late period. This is not abortion. And when you talk to people, they firmly believe this because they've been culturally trained that this is separate. This is a different procedure. And so it is somewhat cultural how you divide up these things that we are. It is an abortion. They're performing. The person is pregnant. But in their mind, because they don't approach it that way, it's not, and it can be. And in some ways, I think that's kind of an encouraging thing. If we can change what we're calling things, let's call these menstrual regulations. We're not performing an abortion, and can we change that?
Thank you for that question, Katie. And I think of I have two ideas. One is that although there are different chapters in the healthcare providers' books, they're often not different chapters in the pregnant person's book. People can have the same kind of uncertainty and distress and grief or joy at the resolution of all of those types of conception. So just recognizing that in people's lived experience, they may exist together. But what I also really hear you say is this distress of making this healthcare provider the person who's in any way trying to arbitrate which bucket they have to be in. When in part of what you're saying, although they're different chapters, they're often the very same medication.
Yeah.
Right.
The
or the same
very
procedure.
same techniques are used in
mhm.
all of the systems. And so we shouldn't be in a position of forcing the pregnant person or the person that's caring for them to somehow articulate that some of these are permitted in certain ways and others are not permitted when they're really the same phenomena. So thank you.
So we're going to lose our caterers if we don't wrap up here. So
All right.
I am going to challenge Michaela to one speedy question.
Okay.
And you all to succinct answer.
All right. All right.
All right, I'll do my best.
You've got the last
So
one.
I'm Michaela Smith. I'm also with Open. And we talked about galvanizing, right, the public and what that would look like with the headline. My question is around what you think it would look like among doctors as a professional organization. And I think in particular, the compelled speech kind of things like that seems like it should have implications outside of abortion. And so just a question of whether you think that these kinds of changes will galvanize that group.
But right. We already have compelled speech in a lot of states. And, I mean, this is not my area of expertise, but it seems like part of the problem is that like abortion providers has been, sort of walled off from a lot of the rest of medicine. So maybe people think that, this kind of compelled speech, this is just my supposition, don't necessarily apply to them. I do think, I would think that a lot of doctors will be galvanized by the fact that, again, they're like Oklahoma, for example. Oklahoma already had a law that performing an abortion would get you 5 years in prison. And they just passed another law that makes it 10 years. So there's like these extremely draconian penalties coming down the pike. And again, I think given the uncertain lines sometimes between like miscarriage management and abortion or dealing with, sort of pregnancy complications, you would imagine doctors using some of their clout, but, I think we haven't seen doctors, you see some of it, but I think it's been a real problem that a lot too many doctors kind of don't see this as their problem.
So I'll invite you as you move over to the snack area to continue some of these conversations. But I do have to say this, suddenly the idea that we are compelling doctors to say certain things in the context of abortion, and yet you can't compel the tobacco industry to put a graphic image because because in that instance, compelled speech is unacceptable. So I want to thank all of you for coming. I want to thank those who joined us online, and thank you for asking questions. I know you have more. This was your first talk back, and I'm not going to say post-pandemic. I'll say in a pandemic-altered world, and it's our first one back too. And it's our first experimentation with doing things hybrid. And this was the very event that was our last face-to-face event prior to pandemic. So I hope this will not trigger more bad things to come. So thank you to all of you.